In this part, we are talking about creating realistic and reasonable expectations for care. This is an area where family relationships and caregiver relationships frequently go off track. We'll talk about tips to avoid caregiver resentment. Let's start, as we always do, with the slide about housekeeping. I use the term elderly parent or elderly parents for the person for whom you provide care. As always, print out the outline for the module, print out the slide handout so that you can make notes and fill in those empty dots on all of the slides. Let's talk about the objectives for creating realistic and reasonable care relationships. At the end of creating realistic and reasonable care relationships, you should be able to recognize aspects of caregiving relationships that turn into resentment. You should be able to create written plans and care agreements to manage expectations and identify why estate plans are essential to support care. Let's talk about the objectives of conversations to avoid resentment. You should be able to initiate positive conversations with elderly parents at the end of this part and create steps to balance caregiving duties and care responsibilities with elderly parents so that you are not feeling like you have to do it all, which is a concern that I constantly hear from so many caregivers. Becoming a caregiver usually happens as an unexpected event. I don't know how you all got into your caregiving situation, but in many situations, it wasn't really anything that you planned to do, it just happened. Conversations about expectations for care rarely happen because when you're new to caregiving, you don't know how important these conversations are, and you don't know how not having these conversations results in resentment and problems. In the best of situations, in perfect situations, if you can talk about expectations at the very beginning, it avoids a lot of problems later, but that rarely happens. The most positive caregiving relationships are based on equal participation and thorough communication and good communication. Having different expectations about care, it's one of the most common reasons that we resent our elderly parents or that they get angry at adult children who are providing care. Most elderly parents, they don't want to be a burden on their children. Other elderly parents expect you to provide care and drop everything. Communication and social skills are learned skills that help avoid resentment in family caregiving situations. Interpersonal relationships in life, any aspect of life, they can be complicated, and in caregiving, based on that foundation of the caregiving situation, set the stage. So for example, a spouse caregiving for a spouse or adult children caregiving for elderly parents. Years of family and personal history come into play when caregiving becomes part of a relationship. We all carry around mental baggage. It impacts how we approach caregiving, expectations, and relationships. When we transition to being a caregiver, learning new skills and approaches helps us manage through sensitive issues. Managing all aspects and expectations through preventative actions and planning is the best way to avoid unrealistic expectations and having frustrating relationships with elderly parents and siblings that happen so often. When you learn to have conversations where everyone listens and everyone expresses empathy, cannot stress the importance of empathy enough. When you avoid any type of blame, you avoid caregiver resentment. Caregiving discussions are essential. Caregiving participation must be 50-50 between elderly parents and family members as long as possible. And we'll talk more about this. I put in that as long as possible because as the health of your elderly parent declines, more tasks and more care burdens shift to you as the caregiver. A diagnosis of memory loss may mean that more care is needed earlier and for a longer time frame, because your elderly parent becomes more forgetful and they become less able to physically do things for themselves. Any type of physical challenge, a chronic disease, and difficulty performing activities of daily living, bathing, dressing, eating, toileting, transferring, can also result in more significant care. Let's talk about having adult conversations. And I laugh when I say adult conversations, but because we've had these relationships with our parents so long, and sometimes they view us as the child, and we view them as the parent who we think knows everything, we can forget that we are having an adult to adult conversation, not a parent to child or child to parent conversation. When we look at these conversations from a point of having mutual respect, having to do a little bit of negotiating, because many times we're negotiating, am I going to do this? Or are you going to do this? Or what are you going to do? What am I going to do? When we look at the idea of being a team with our elderly parent, that idea of 50-50 participation becomes easier to understand, and we have to talk to our parent in those terms. Mom or dad, we're going to work together through this. We're going to be a team to get together through this. It's 50-50 participation. I'll do my part, you do your part. Very, very important. So your parents, no matter how old they are still your parents. It is true that you're noticing the roles reversing. You are or will eventually provide more help and more care. But that doesn't place you in a position of giving orders like many adult children want to do, or making decisions without talking to your parents first. Those are pitfalls that happen in caregiving relationships that set them down the wrong track. And I joke about this, but it happens all the time, because it's easier for you to make a decision than to have to negotiate or ask your parents' permission. Caregivers want everything done their way because a lot of caregivers feel like you're giving up so much of your life to care for elderly parents, to care for these people pictured here on this slide. And no doubt you are. But put yourself in the place of an elderly parent who is vulnerable and who needs help and who has to rely on you. Be as empathetic, patient, and kind as humanly possible. Realize that your mom or dad, caring for your mom or dad, are going through a lot of stress. Spousal caregiving relationships can be even more challenging than the relationship that you have with your parent. Be extra empathetic to your mom or dad who's the caregiver. Spousal caregivers tell me all the time that they feel isolated and unable to talk to anybody about their feelings, including their adult children who they feel will not understand. Also, concerns exist by mom or dad about saying anything negative about that spouse who needs care for fear of being perceived as negative or complaining or disrespectful to that marriage. That leaves your mom and dad in a really hard place, having nobody to talk to, no confidant in the family who really understands, or they're afraid they'll be judged. It's very difficult to be that spousal caregiver. Let's talk about 50-50 participation. Focus on the idea of 50-50 participation in all aspects of caregiving relationships, and really in every relationship of your life. You can translate a lot of the things from this course to other parts of your personal life, other parts of your work life. Spouses and elderly parents may arrive at a point where they can become apathetic if you allow that to happen. Elderly parents may lack motivation, and they may want you or expect you as the caregiver to do everything. That is not practical. Simple examples of 50-50 participation, you can jot these down. You may do some of these in your family life. Doing dishes after dinner, folding and putting away clothes together after you do laundry, cleaning the house together, the caregiver bringing in groceries and your mom or dad putting away those groceries. Doing these activities together, yes, they take more time, probably easier if you do them yourself, but when you do them together, they bring the caregiver and that person who needs care closer together because you're both participating. It's like teamwork. Another important area, and sometimes I feel like we shouldn't have to talk about this, but we really do in caregiving situations because interactions in caregiving relationships can become very strained. We can lose patience, become frustrated, say words that we regret. Here are some simple ground rules to mind your manners to support positive caregiving relationships. Always say please when asking, when making a request. Say thank you when somebody does something for you. Show respect to each other as you want others to respect you. Let the other person finish before you speak or interrupt. Avoid using bad language or cussing. That can make people feel very uncomfortable. Ask permission before touching, taking, or moving things in your parents' home. If you have a loved one with memory loss, they will never be able to find that item that you move because they look for it in that same place all the time. Clean up after yourself. Don't make a mess. And this is one of my favorites. Women, you probably are with me on this one. But put that toilet seat down. Write a thank you note to show appreciation. Think of 3 things that you can appreciate about life every day. Caregivers, put away technology at meal times or during conversations so that you can focus on being with mom or dad. Don't be constantly texting or checking your email or picking up your phone. If you're expecting a call, let your parent know and say, Mom, when that phone rings, I'm going to have to answer it. I need to take a break, so that they know that you are being attentive to them. When you lose patience, say I'm sorry and apologize. If you make a mistake, apologize. If you say something that upsets a loved one, apologize. Always say, let's do this together, to reinforce that idea of 50-50 participation. When you have an idea, say, what do you think about this? How do you think about we can do this together? Always give a hug, say, I love you. Say, I know this is hard for both of us, especially on days when caregiving feels impossible. Remember that that little kiss or that little hug goes a long, long way. Let's talk about guidelines for equal participation. As elderly parents age, their physical abilities worsen. Their brain functions and their memory may become worse. Our parents want to maintain control of their life and continue to make day-to-day decisions. And this is where, as a caregiver, we want to be more sensitive and respectful of creating balance in relationships. While we know that it is so much easier from a time and efficiency perspective for us as caregivers to just jump in and get those jobs done at lightning speed, that's really not in the best interest of maintaining balance and helping our parents maintain independence in a long-term care relationship. Caregiver perceptions of what is best for elderly parents can be skewed by time-pressed life situations. Think of yourself in the workplace. How would you feel if somebody just took away a project or part of a job that you enjoyed without even asking you? You probably wouldn't like it. You may feel like that person who took that responsibility away thinks that you're not doing your job or that you can't do the job. Elderly parents can feel the same way when adult children want to take over tasks that your parent can do, but maybe they are just very slow at completing those tasks. Let's talk about the risks of doing too much too soon. Taking away tasks can result in elderly parents losing their purpose in life, that reason to get up out of bed every day. If you take away those tasks, or if they feel like you don't think they can do them for themselves. Parents have an increased sense of worry and a decreased self-esteem, they can actually become depressed when they feel like they can't do projects anymore, when they feel like you have to take over. So instead of taking away those tasks, instead of removing tasks, have a discussion with elderly parents and talk about why you feel that you or somebody else should do the task. Look at options for your elderly parent continuing to do the task. And here's an example, and again, you can write this down. Let's say that if going down to the basement to do laundry is a worry because you think your parent is going to fall. What are the options so that your parent can continue to do that task without you being concerned about safety or them falling? Can you install any type of safety equipment? For example, a double stair railing, which means there's a railing on the left and the right of the stairs. Can you talk to your parents about other safety equipment and supporting their abilities to do these activities of daily living? We talk about this a lot in the module called Home Safety for Elderly Parents, Tools and Tips, but we'll touch on it briefly here. If the only reason for going down that basement is laundry, can you move the washer and dryer upstairs? If the reason is physical weakness, what about, and we've talked about this, an exercise or a physical therapy program to support leg strength and balance? And what about one of those I've fallen and can't get up buttons? Again, we'll talk about that in the module for home safety. So before taking away an activity that makes an elderly parent more dependent on you, instead, look at all of the options to help your parent to continue to complete that task. Elderly parents will feel better about themselves and about remaining independent longer, which really is the goal, isn't it? This is a great one that a lot of caregivers don't think of. In the idea of 50-50 participation, ask how elderly parents can help you. For example, if your mom loves to cook and you are trading your time to help her each week, can mom give you a little bit of her time? Can she make leftovers for you to take for lunch at work? Can she make leftovers for meals for your family that you can reheat during the week? There are so many ways that elderly parents can help you. Other examples, if a service person has to come to your home, can your elderly parents be at the house to let them in? And then they can have that service provider call you for specific instructions or concerns. There are so many creative aspects to caregiving relationships that most families don't think of because as caregivers, honestly, we are just trying to get through the day. We're trying to get everything done versus thinking about the reverse. We're helping our elderly parent. How can an elderly parent help us? And when we look at the big picture, there are so many more options for 50-50 participation. The reality is that caregivers become exhausted, and physical and emotional exhaustion are common because of all that day in, day out wear and tear of work and caring for your family and managing your life and doing all these caregiving activities for elderly parents. Caregiving exhaustion is another reason that resentment creeps into caregiving relationships. Ask how your elderly parents can help you. Ask what they can do for you. Through conversations and expressing empathy, we can reduce caregiver resentment. 50-50 participation establishes better expectations that support positive relationships. And look at caregiving relationships with your elderly parents as ways to increase your communication skills and your social skills. Research out there proves that people who have better communication skills, who are more empathetic, who can understand how their behaviors affect other people and appropriately respond, people who have good social skills, when we learn these skills, we become more successful in all aspects of our life. Yes, I realize that interacting with elderly parents can take a lot of patience. It can feel draining. It can feel exhausting. But if you can resolve these resentment issues in family relationships, trust me, it transfers to so many aspects of your life. You will be so much better in your work relationships and in your other personal relationships because you learn how to get along with people. You learn how to be a team player. You learn how to negotiate what you want and what another person wants and how to come together in the middle. I'm Pamela D Wilson, caregiver expert, advocate, and speaker. Thank you for joining me for this caregiving webinar. Think of ways that you can translate these skills that you're learning here into other parts of your life. I look forward to being with you in another webinar. It has been my pleasure to be here.